Today topic is pharmacy audit. So in a pharmacy there are legal requirements should be available. So in the sense drug license, spirit license and narcotic license. These must be available in the pharmacy and the same thing has to be displayed and it should be a valid. In the pharmacy, the person dispensing the medicine, the pharmacist should be qualified. The qualification certificate should preferably displayed in a pharmacy. Those who are working in a pharmacy, they should be qualified with a D Pharma or B Pharma, and same certificate must be displayed in the pharmacy. And also pharmacy should have a list of prescription drug. It should be available in the pharmacy and the drug will be dispensed only against doctor prescription. Schedule X and H drugs are dispensed against valid medical prescription and a copy of prescription is retained for about 2 years. If the hospital pharmacy sells the medicines to others who are not the patient of hospital, and there is a proper protocol on physician sample. Physician sample not be sold in a pharmacy. They should have a proper policy on samples, physician samples. And also pharmacy should have a drug formulary. Pharmacy store should have a medicine as per the hospital formulary. A copy of formulary with the pharmacy in charge. The formulary should be in consonance to National List of Essential Medicine and WHO Model List of Essential Medicines. And also the pharmacy in charge should be aware about what to do if there is a demand or request of medicines that is not listed in a hospital formulary. So the policy should be well versed by the pharmacist. And also the pharmacist should be well versed with the ABC analysis. What is ABC? A stand for expensive inventory, and a pharmacist should have a accurate control on this expensive inventory. And B, it is a moderate value of inventory and moderate control required for the inventory. And C is low cost inventory, so minimum control should be there on the inventory. And also pharmacists should know the VED analysis. VED in the sense the store when subjected to analyze based on their criticality can be classified into vital, essential and desirable stores. This analysis will help for proper inventory control. And also pharmacy in charge supposed to check an inventory of their stock. So proper inventory checking, again it will help for the pharmacy for avoiding of pilferage. And also the pharmacy in charge should be well versed with the vendor selection. So good vendors selection is very important. And also pharmacist should store the records of purchase and goods receipt notes in a pharmacy. And also his responsibility is to keep all the stock audit records including physical verification must be in place in the pharmacy, so that stock audit definitely it will help for the pharmacy and to improve the business, and also it can prevent a pilferage of a pharmacy stock. So maximum once in a month or they should keep a schedule for stock audit. So same record must be maintained in the pharmacy. And also the pharmacy room and area used for medicine storage is clean, uncultured and devoid of pests and rodents. Medicine should be stored on floor. Records of regular pest control should be available in a pharmacy. So cleaning checklist and pest control records must be available in the pharmacy. And also in a pharmacy appropriate security arrangement like installation of a CC camera and restricted entry. So these two will help for prevent pilferage of medications. So proper security should be available in a pharmacy, and also pharmacy in charge should be well versed in the implant, issue and receiving policy. And also in a pharmacy, very important thing in the sense, medicines are stored in a condition as directed by the manufacturer. So proper maintenance of a temperature, humidity should be recorded, and same must be available in a pharmacy. And also whatever the medicine should be stored in a refrigerator, the same medicines only should be stored. Room temperature drug should not be mixed in the refrigerator. Only which is recommended to store in a fridge, only that medication has to be stored, and record of a temperature, and 3 times a day the record of a fridge temperature is very important. Freezer temperature and fridge temperature has to be recorded, and same document must be available in the pharmacy. The room temperature must be 18 to 25, within that it has to be maintained, and fridge 2 to 8. So if there is any low or below, the action must be taken immediately. And also the pharmacy in charge should be well versed with the look-alike and sound-alike medications. So again, look-alike and sound-alike medications are identified, and the list has to be available, and also it should be displayed in all the nursing station also. The pharmacy in charge should give a color code and segregate a medicine and store it in a different rack, so that we can prevent a medication error in a pharmacy. And also the pharmacist is well versed with the high risk medications. So the high risk medications list also must be available in the pharmacy. Based on that, the drug has to be stored. So preferably these high risk drugs has to be like anti-infective, potassium, insulin, narcotic, chemotherapeutic agents and heparin. So these drugs must be stored in a proper places, preferably single lock, and senior in charge of a pharmacy has to dispense the medicine, and cross verification has to be done once the high risk medications issued. And the pharmacy in charge should well versed with the verbal order or telephonic order. Whenever he takes the verbal order, he should check for the proper prescription, name of the drug, dose, frequency, route, all those things he has to written in a note, and same thing has to be repeat back to the advisor. And also the pharmacist should know the cut medication policy. So cut medications has to be labeled properly with the name of the medicines, batch number, expiry date, and this has to be stored in a ziploc cover. So the label must be available in the cut medication pouch. And also pharmacists should know how to dispense the medications. So dispensing policy, he has to well versed. Dispensing in the sense, he has to know the prescription policy. Once he get a proper prescription, then based on the prescription he has to dispense the medicine for the right person and right medication. And also pharmacists should know the policy on prescription. So prescription policy, always the consultant or doctor will write a prescription, so he has to check in detail of a prescription, in the sense patient details and name of the medication, dosage, all in detail of prescription should be present, verified before dispensing of a medication. If a pharmacist found any improper prescription or illegible or not clear, the prescription must be resent to the doctor or to the department, and fresh prescription has to be obtained. So once the prescription is clear and legible with all the content of a medication orders, then only the pharmacist must issue the medication. And also pharmacists should know the FIFO system. FIFO in the sense first in and first out is an accounting method in which assists purchased or acquired first or dispensed of first. And also then pharmacists should know the policy on recall, drug recall policy. Staff at a pharmacy are aware of situation when medicines recall is warned and the procedure of recall. So whatever the recall drug policy, he should be well versed. And also pharmacist should know the fire safety. If there is any fire in a pharmacy, how to manage. He should not get any panic as per the fire protocol. Pass and race and pass method he is supposed to use whenever the fire happens. And also pharmacists should know the MSDS policy. MSDS in the sense material safety data sheet. For each hazardous materials, it has to be kept separately and the list should be available how to follow if there is any spillage or exposures to the person. So proper protocol has to be followed in a pharmacy and storage policy also properly followed in a pharmacy. If there is any chemical spillage happens to the pharmacy, and he is supposed to know how to manage the chemical spillage or splashes. Immediately the concerned department he has to intimate, so as soon as possible the treatment has to be started. Always in a pharmacy, chemical spill kit has to be kept ready to manage this kind of accidental spillages or exposure. And also pharmacy should know the near expiry policy and expiry drug policy. So nearing to the 30 days, all the medication has to be segregated from the stock and it has to be stored separately, and it must be handed over to the vendor, and fresh medication has to be taken from the vendor. So there should not be any expiry drug in a pharmacy stock. Finally, the pharmacy should know the quality indicator of pharmacy, especially like incidents of dispensing error, prescription error, incidents of emergency drug stock out, and incidents of drug recall. This has to be monitored on daily basis, and if there is any incident, immediately corrective actions must be taken.